and that is this. What I have drawn here is not a zit. That is something that is blocking the tube. Now, in the United States in 2017, the most common things to block a tube are scars from chlamydia. It used to be scars from gonorrhea were the primary things the most common things that block the tube. But today, the most common thing that blocks a tube is a scar or more than one scar from chlamydia, which is an incredibly common sexually transmitted disease. It's so common that it's hard to even imagine that it's a disease. It just seems like it should be normal. Chlamydia is just very, very common. So I'm not trying to say anything crazy. I'm just saying, at what point is something so common that we don't think of it as a disease? Hard to say. I'm not hard to say, but you watch. This is how things change. So anyway, if a woman gets chlamydia, it results in scarring of her fallopian tube. The way I've drawn this scar, the fallopian tube has a little space. So that little space is enough for the sperm to get up, and they get there and they say, oh my God, what's this? And they swim around it, and they get up to the antrum, and they get to wait for a little egg. Oh, by the way, they don't really wait. They just keep swimming. And don't forget that I said that, because I'm going to come back to this in a minute. Now, if this scar is big enough that the sperm can't get by, then that woman is not going to be able to get pregnant because the sperm can't get up there. But if the scar is not big enough and the sperm can get by and the egg gets fertilized in the antrum, and then the fertilized egg starts its trip down there, remember the fertilized egg is dividing. And each time it divides, it gets bigger. So by the time it gets to this spot, it might be so big that it can't get past.
Oh no.
That fertilized egg is not just going to stand there saying, oh, what next? Fertilized eggs try to implant. So at 6 days or 7 days, it will try to implant. And if it isn't in the uterus, it will try to implant on the fallopian tube. That's called a tubal pregnancy, which is one of the forms of ectopic pregnancy. Ectopic means outside of its normal place. Ecto means without or outside of. And opic means place. So for you Ghostbusters fans, ectoplasm is plasm outside of the normal body. A ghost. There's no such thing, but Ghostbusters. I love the Ghostbusters. So the tubal pregnancy is that what will happen is the embryo will try to implant on the tube, and then it makes all these hormones that draw major amounts of blood vessels to the tube. The tube cannot support the pregnancy. Ultimately, it will rupture. The tube will rupture, and both the embryo and the woman will die. This is a 100% fatal occurrence unless we treat it. And you treat it by diagnosing it and surgically removing the ectopic pregnancy. And if it happens in a tube and you get it real early, you might be able to save the tube, but mostly you have to take it out.
Yeah, you said if it's big enough, the sperm won't go by, which is fine. I get that. But what about the egg that's coming up that way? Does it?
Yeah,
just, like,
every
reabsorb
month,
itself?
every month it just finally dies and breaks down and gets reabsorbed. Yeah.
So how is that diagnosed?
Uh,
You're gonna have some form of
They get a
Sometimes.
positive pregnancy test, but the pregnancy is not progressing normally, and they do an ultrasound and it's not in the uterus, and she may well have pain. What if there's fertilization and the egg doesn't head this way? It falls out. Remember, The ovary is not attached to the fallopian tube. So the egg can, and occasionally does, fall out into the peritoneal cavity, at which point you get an ectopic, a peritoneal ectopic. And the embryo will try to implant wherever it lands. It might land on the peritoneum overlying the large intestine, it might land on the bladder, I mean, it might land anywhere, and you get an ectopic there and the exact same result. You have to surgically remove that to save the woman's life. We cannot save this baby's life. Ectopics are 100% fatal, 100% fatal under all circumstances to the embryo. And they will be fatal if not treated surgically to the woman.